with a whole lot of truth. Remedy Revolution is here for you. Ooh. And now here's your host, Aaron Page.
All interviews presented on the Remedy Revolution podcast are designed to provide information and inspiration only. Guests of the podcast may present opinions and anecdotes which are solely their own. And as always, before beginning any treatment protocol, please consult with your preferred medical provider. Hello, everyone. Welcome to the Remedy Revolution. My name is Erin, and today's guest is somebody who I find to be incredibly accomplished, probably a grandmother's dream, right? Because most grandmothers say they want their grandchildren to grow up, become doctors and lawyers. Well, this gentleman became both and an accomplished author. He's got many books under his belt. I'm very excited to have him here on the show today, and I'm going to let him tell his story because I think it's pretty interesting. Welcome to the show, Dr. Tom Levy. It's such a pleasure.
Glad to be here, and thanks for the invitation.
Absolutely. So tell us a little bit going into this about your journey. So I know you initially started off as a cardiologist and then transitioned and decided to get into law, and that had a lot to do with some of your research. Can you tell us a little bit about that?
Sure. Basically, I was a mainstream cardiologist until and up to about 1993 in Colorado Springs, Colorado. I must say, even at the time this happened, I was questioning myself as, is this what I want to do for the rest of my life? I kind of had a sensation I wasn't doing what I needed to do. Not that I didn't think I wasn't helping my patients, but that I had a different niche. And doggone if within a very short time frame of that, I met Dr. Hal Huggins in Colorado Springs, Colorado. And to my knowledge and my conviction, he's really the first true biological dentist in the country and the world at the time. And much of biological dentistry has stemmed down from him. Biological dentistry, of course, meaning not just mechanical dentistry, just dentists and dentistry that's fully aware of the fact that I am being a little sarcastic here, that the head is attached to the rest of the body and there are consequences for what's going in, and you just can't approach the mouth from a mechanical point of view. You have to consider everything that's being impacted physiologically. And he invited me to see his clinic. I did. I saw amazing things taking place there that modern medicine told me was not possible. I even had occasion to see a little old lady in a wheelchair get 3 hours of extraordinary dental work, the type that puts a college kid to bed for a week, and this lady was getting more and more energized as the procedures went on. And when it was all over, she was asking her caregiver to find a great restaurant in Colorado Springs to take her out to that night, even though a bunch of teeth had been pulled out. And Hal walked into the room, Dr. Huggins. I said, Hal, what's going on? And he pointed to the IV bag. Turns out the IV had 50 grams of vitamin C in it. Well, like the rest of quote unquote modern medicine, that meant nothing to me at the time. Vitamin C is not even mentioned in medical textbooks. But I like to say, and I'm proud to say, I'm not in the habit of denying what my eyes have witnessed. And that literally in that instant began my more or less 4 years of research with vitamin C leading up to my first significant book, Curing the Incurable, Vitamin C, Infectious Diseases and Toxins. And at that point in time, I completely ditched my cardiology practice. I began working as a consultant with Dr. Huggins, and he was very generous. So it was a good move economically for me as well, for that matter. And over the course of the next few months, I just saw all the legal brutality Dr. Huggins went through, such that he had a lawyer on retainer. And it's a big whim, but really on a whim, I took the LSAT test and got a sufficient score to get in the University of Denver Law School. And over the next 3 years, commuting from Colorado Springs to Denver, I got my law degree without a clear idea of what I was going to do with it. It just felt like the next step. And I think retrospect tells me that it has protected my warm body and brain quite a few times now. So anyway, that began my odyssey. Dr. Huggins passed some time ago. I wish he was still here, but he started all the solid foundations with me. I really and truly, and I'm not exaggerating this when I say Hal gave me my first true medical education. A dentist gave me my medical education. Medical school was just facts. There was no correlation, no really true independent thinking. Like, here it is. If you have this fact, you do this, and that's it. And of course, medical students and residents are very good at memorizing facts and then regurgitating them on tests. But there are a lot of situations that became apparent to me where you really need to dive in and try to think independently, not necessarily radically, but independently, using logic. And that's what Hal taught me. And I must say, some 13 books later, 12 or 13, lost track, we're here right now. And so many things are continuing to evolve from that point in time that are pretty much focused and spurred on by the physiology of vitamin C. But what I write about and what I do and what I espouse is so much more than just taking a large amount of vitamin C.
Yeah, well, I think that's so true. And obviously, over the last several years, we've seen so many medical doctors being persecuted for going against traditional narrative. And I think just by way of critical thinking, I'm not saying that they're, going way out there. I know a number of doctors who were really persecuted, threatened to take their licenses away, simply because they were advocating for things like vitamin C, vitamin D, and even pharmaceuticals. So it's definitely a much needed field of study, to have people that are involved in both medicine and law to make sure that these doctors who think a little bit outside of the box are protected. So I do want to get into a little bit of the vitamin C. So you mentioned about Dr. Huggins' patient with the IV vitamin C. So when we're talking vitamin C, from your perspective, there's a lot of different forms and there's a lot of confusion about those different forms. So what specifically are you referring to?
Well, vitamin C, you need really large amounts of in whatever is the best and most efficient and economical fashion for you. I mean, that varies widely right there. The reason why, because a lot of people, some very prominent people, prominent docs, just say, well, any more than 500 milligrams is a waste, blah, blah, blah. Well, the first thing you need to realize is that the human beings, almost everyone, is a genetic mutant, okay? In the liver, you have a 4-enzyme sequence that's designed to convert glucose in your liver to vitamin C, ascorbic acid, injected directly into your blood. And the 4th enzyme is deficient and not functioning in human beings. Whereas in animals, most wild animals, and if you take a comparable animal like a goat in body size, 150 pounds, that goat will make on a regular basis, without any stresses, 5, 7, 9, 10 grams a day and secreted directly into the blood. Now, right there's no amount of supplementation you can take that would get absorbed sufficiently to give you the benefit and equivalence of getting 9 or 10 grams directly injected into the blood. However, that's only the start of it, because if you give that goat a severe stress, a large toxin, a life-threatening infection, the oxidative stress inside the vasculature will cause a compensatory upticking of the vitamin C generation for the liver, such that that goat might be making 30, 40, 50, 60 grams a day, again, directly into the bloodstream. And with this in mind, then, I go through all of that because so many people say, well, if you eat a perfect diet, you should have everything you need. Well, yes and no, okay, because of two things. One is, like with vitamin C, we should be having much larger amounts in our body, none that could even be approached by supplementation. And number two is, we live in a toxin cesspool these days, and toxins are all pro-oxidant. Vitamin C, antioxidant. So you gotta pay the piper. If you're exposed to a ton of pro-oxidants, you're gonna need a ton of antioxidants. And there's no way around it. You just can't get a antioxidant debt, so to speak, and thrive. So those are all the reasons that we go into the dosing that we go into. For practical purposes, I think most people should be on between 3 and 9 grams of vitamin C a day in divided doses, maybe 3 times a day. Probably the sodium ascorbate, although ascorbic acid is fine as well. If you can afford it, it's a little more expensive, but it's much better. The Live On Labs liposome encapsulated vitamin C is magnificent. And I've had many experiences where using enough of that orally has given me the same or better impact clinically with intravenous vitamin C, even of a much larger dosage. So if that would be just a couple grams a day of the liposome. You wouldn't need to repeatedly dose it through the day. There are other forms of vitamin C, other ways of dosing it. Obviously, there's the IV, the Reardon Clinic in Wichita, Kansas. We've developed a wide variety of different protocols for working with and optimizing vitamin C impact by giving it under a various number of different intravenous regimens. But in a nutshell, and of course, the sicker you are, the more you need. By that, I mean it's an antioxidant. And all disease, 100%, all disease, no exceptions, all pathology inside the cell is due to pro-oxidants. And those pro-oxidants have the name toxins. Okay, so there's a wide variety of toxins, but they all have the final common denominator of getting to biomolecules, proteins, enzymes, sugars, etc., taking electrons away from them. That oxidizes those biomolecules and inactivates them. They no longer become players. They become inhibitors. They're not doing anything then but occupying space inside the cell and preventing the other biomolecules from optimally interacting. And the thing about the toxin is once it takes that electron, it becomes very stable and it never gives it back. So toxins block microcurrents and electron flow inside the cell. Antioxidants, which go back and forth, back and forth, back and forth, promote electron flow. And for anyone who's not realizing it, it's a simple statement, but it's true. Electrons are life. That's it. The electrons are life. And your diet is only good to the point that it brings in new antioxidant, electron-rich nutrients that bring new electrons into the body. You never generate new electrons inside the body. But all you do with vitamin C and other things is you optimize the distribution. So that pretty much is the power of vitamin C. And it's borne out with 80 some years of research where it really just has improved or cured just about every infectious disease known to man, certainly all the acute ones, and strongly ameliorated all the chronic ones like the chronic hepatitis, Lyme, and things like that.
Sure. So speaking as someone who has struggled with chronic Lyme in the past, where are you seeing the most benefit? Let's say, with IV vitamin C, are you talking about, once a week? What kind of frequency would be needed to help somebody kind of get over that hump of a chronic illness?
There are protocols that work and work consistently. One that's not practical for most people, but it demonstrates the fact that it can be done, is when you give high doses of intravenous vitamin C, roughly 50 grams every day for 3 weeks. Okay. And what's counterintuitive for a lot of Lyme patients is they don't feel a whole lot better until the end. It's kind of like they don't get a gradual improvement. They just go, go, go. And then, as I've had described to me personally and another doc that I've worked with, it's like on day 20 or 21, a light switch goes off and then they feel great. Now, what that tells me, of course, is that the Lyme pathogen is embedded and difficult to get to. Okay, if it were in the circulation, it'd be no problem. Well, there are other ways, I believe, that are much simpler, okay, and much less involved. It's still always good to initially get, preferably for several days, not just one time, and not necessarily 2 weeks, but at least for several days to a week, the IV vitamin C, okay, a good ozonation of the blood, okay, ultraviolet blood irradiation. This, incidentally, is all offered at the Reardon Clinic, where I'm a consultant to. I don't work there.
Yeah, I've actually had UVBI. That was one of the best treatments for me. Absolutely, 100%.
And other important things that seem unrelated at first are hydrogen peroxide nebulization, because everybody, unless they've had this, has chronic pathogen colonization in their nose and throat that they're not aware of, but they're swallowing those pathogens and toxins 24/7. They're keeping the gut leaky and the microbiome abnormal, and more pathogens or toxins are getting into the blood and into the brain where all this stuff is going on with Lyme. So using that as a combined protocol. And the other thing is high doses of I call them the Power 8 supplements. Okay. That is ones that we're most familiar with, but important: vitamin C, vitamin D3, magnesium, and vitamin K2. All of these things help to normalize calcium levels inside your cell, which underlies all oxidative stress. Okay. All of it. If you could bring, and as calcium is up, magnesium is down. As you build magnesium up, calcium has to come down. They can't exist together in elevated states. So there's the first big one there. So that helps get you optimal levels of vitamin C in the cell. But the real kicker now, especially for anything neurological related, and I would consider Lyme to be largely a neurological infection, and that is the ATP stimulating supplements. We all talk about mitochondrial dysfunction, but I haven't seen to date, to my knowledge, a lot of clear-cut practical protocols for restoring it. Well, this might help, and this might help, and this might help. Well, you have a normal cell when you have normal vitamin C levels in it, and you have normal levels of ATP production in the mitochondria. When you have those two things, the cell is normal. No pathology can exist any longer, infection or otherwise. Well, let's go back to the electrons. When you have the nutrition bringing in new electrons, then they enter the cell. Very simplistically speaking, they get funneled through the Krebs cycle, and then the Krebs cycle presents them to what's called the electron transport chain, a 4-step chain that ultimately allows the electrons to be delivered to ATP synthase and produce the large amounts of ATP you need for energy use throughout your body. ATP low, energy low. ATP high, energy normal. Okay. Well, the first step of this, and this was very profound work that was done by Dr. Abram Hoffer back in the early part, probably, the 50s and 60s. And he found that niacin, properly dosed, cured schizophrenia most of the time, okay, as a monotherapy. But I'm going to expand on that monotherapy. Well, what niacin does is also done by its vitamins, like niacinamide, very close to niacin, is the first step of the electron transport chain is where NAD, nicotinamide adenine dinucleotide, gets the ball rolling. Well, any chemical or metabolic reaction needs continual new amounts of substrate to continue to work. And if you let the substrate get depleted, it doesn't matter if everything else is functioning, because you're not going to get a good reaction. You're not going to get a good shuttling of the electrons. Well, niacinamide in a dose of up to 3 grams, maybe a little more, but between 500 and 3,000 milligrams, massively upregulates NAD. It's the direct precursor to NAD. We hear a lot about NAD supplements now,
Right.
And those are fine and good. They're a little costly. They're talking about IV NAD. That's good, very costly. Niacinamide is very inexpensive and very effective because it is the primary precursor to NAD. The second step is FAD, flavin adenine dinucleotide. The direct precursor to that is vitamin B2, riboflavin. Okay, the niacinamide, vitamin B3, the riboflavin, vitamin B2, and taking roughly 400 or so more milligrams of that a day powers up that stage. Very cheap. Of note is it will turn your urine bright yellow. So that's why you get the banana bag. The riboflavin is what's causing the yellow coloring, and when you put it in an IV. Number 3, by itself stage is coenzyme Q10. Extraordinarily powerful supplement. It even helps stimulate the other 2 stages. Coenzyme Q10, I think everybody should be taking at least 300 and up to 600 or 900 milligrams a day. And then you go to the last stage, cytochrome C oxidase, and lo and behold, methylene blue strongly allows and donates electrons directly to that and skips the first three steps. So there's no obligatory oxidative stress that would have been generated by going through that pathway. Instead, it goes straight to the payload, if you will. This is why methylene blue is so powerful all by itself. Many people, when they start taking enough methylene blue, their depression, serious depression, disappears in a few days, okay? All the other anxiety states, whether it's an emotional state or a physical state, it all has to do with increased inflammation and decreased ATP production. So those four, the methylene blue, I would say between 25 and 30 grams a day. Okay, there are different ways to take it. That's another story. But those Power 8 supplements, vitamin C, vitamin D, magnesium, vitamin K2 for calcium, and then niacinamide, riboflavin, coenzyme Q10, and methylene blue to amplify and augment ATP production. And let me tell you, Aaron, all sort of stuff starts going away.
Yeah.
You have to realize we're focusing on the brain and talking about this, but these supplements are affecting every cell in your body. They're affecting every cell in your body, not just the brain and not just others. So I've had so much feedback. I mean, it doesn't matter what the symptom is. Lo and behold, after a few weeks or something, people start realizing, wait, I don't have that symptom anymore. I mean, when you normalize the oxidation level inside the cell to just physiological degrees, everything gets better, unless you already have had secondary structural damage for some reason to a cell or tissue. If you can normalize the physiology of those cells, everything gets better and many things resolve completely, including, as I mentioned with Dr. Al Hoffer, the most heinous of chronic diseases on the planet, which is advanced schizophrenia.
Mm-hmm. Yeah, so it's interesting. We've had Dr. James Neuenschwander on talking about methylene blue, particularly in autism, which has been proving out to be very helpful in those scenarios as well in his practice. But I have a personal experience, and I'm curious as to your thoughts. So when I first took methylene blue, I took 2 drops, and within probably 15 or 20 minutes, I've always had, pretty significant brain fog, particularly in the afternoons. And that's been, pretty chronic for a long period of time. That brain fog within a few minutes immediately lifted. I no longer had the brain fog. I felt much more energetic. Obviously, I'm sure it was assisting with the ATP production. But I will say, as I got to higher and higher doses, I did feel that I didn't see the effect as much anymore. And my question to you is it because I needed to be also supplementing with some of the other things you mentioned simultaneously? Or is it something that we should be cycling through, say, like take it for a week or two, or was it that I had something else that was missing perhaps?
Yeah, I wouldn't see the need to cycle it, as you say, but we mentioned at the outset is, okay, you need, well, let me backtrack. Orthomolecular medicine, ortho meaning right and molecular meaning molecule. All of orthomolecular medicine is, and I've seen no exceptions to it, is all diseases are different nutrient, vitamin, mineral deficiencies, okay? And if they're deficient and you don't address that deficiency, they're not going to resolve, okay? Modern medicine, quote unquote, gives you a prescription drug to gloss over the symptoms, but allows the disease to progress. Well, let me give you my own personal anecdote that I think strongly shows the importance of the fact that you got to restore nutrients. And if you keep a chronic nutrient deficiency, you can do everything else perfect, and it's not going to resolve. That's why good nutrition always has to be done hand in hand with, shall we call it, physiological supplementation that keeps these other things going. Some of them are vitamins, some of them are not. Some 10 years ago, I had been bothered quite a bit with chronic depression. not suicidal, but pretty advanced to the point where I'm saying, what's the purpose of life anyway? I just don't understand this whole ball of wax. And so that had been going on for a few years. And I saw a commercial on TV for the NutriBullet. And I saw it. I said, well, my diet probably sucks enough. I ought to try that. So and let me say, for those who don't know, the NutriBullet is more than just a mixer or a juicer. It actually pulverizes whatever you put into it so that you're taking the whole substance, but in a liquefied form. So I diligently went out and bought several organic fruits, several organic vegetables, and about 6 or 7 different organic seeds. Okay. All the different, I put them all in, and I wasn't expecting anything really, but I fixed it up and I drank it. And all I can say is within a couple hours, I felt peculiar. And then I realized my depression had gone. And it has completely disappeared ever since then. And so what I say to you is somewhere inside those seeds, inside those fruits, inside those vegetables were several nutrients that I was not getting and would never have gotten with whatever diet I was on, and probably would never have stumbled upon the proper supplement to restore it. And this, I think, would be fantastic in conjunction with everything else, Aaron, for autism and for all the attention deficit disorders. I'm strongly convinced 100% of those are specific, not sure which one, nutrient deficiencies that, again, if you don't replete it, if you don't restore it, and you don't have a particular thing that's going to restore it, it's not going to get restored, okay? And you're going to keep the pathology secondary to it.
Mm-hmm. Yeah, so I know you've written a book on magnesium as well, and obviously you're well versed in some of these other nutrients. What are perhaps some of the signs and symptoms that you might want to look at, any of these in particular?
I'm sorry, signs and symptoms of?
Signs and symptoms, say like, for example, if a child is particularly constipated, we might think about, well, perhaps they're magnesium deficient. So are there additional signs or symptoms that would lead you down a path to think that the deficiency might be with one particular nutrient?
Well, the first thing is 100% of the population needs to supplement vitamin C, vitamin D, and magnesium. No exceptions. We're all profoundly deficient in all of those. So anybody, I would start, including children, obviously, I would start by getting on a reasonable supplement program to build those levels up. Other supplements are important, like we already talked about, but those are the pivotal foundational supplements. You got to have enough vitamin C in your cells. You got to have enough magnesium, or nothing works. Okay, they are the cornerstone of pathology via their deficiencies. Now, having done that, especially for the gut, I wrote a book called Rapid Virus Recovery, 2021, to deal with pandemic and an easy way to deal with it. And that easy way is hydrogen peroxide nebulization. And it's been profoundly gratifying. I mean, I've had countless people around the world tell me about everything that was going. I almost lost my medical license over it because of writing it, but for some reason they backed off at the last second and just chastised me for espousing such profoundly ridiculous stuff in my book. Well, as it turns out, I had first started nebulizing with peroxide several years earlier when I was writing my magnesium book, because I stumbled across nebulization and I really hadn't thought about it. I knew what it was, but I never thought about it. And I had been having my entire life problems with sinuses and colds all the time and this, that, and the other. So I said, this peroxide nebulization is going to help, I'm sure. Now, so I'm about 66 years old, more or less. And I do one afternoon, a good long 10, 15 minute session with the peroxide nebulization, 3%. And that's fine, no problems, did well. And this, I don't mean to be indelicate, Aaron, but the next morning, I had the most incredibly eye-popping, profound bowel movement of my life. Nothing else ever came close. I said, oh my God, this is how it's supposed to be. Okay, so I won't get into the actual details of the character quality, but you get the idea.
Right.
And so I immediately said, wow, what's going on here? And as it evolved, I then began to realize that we have this concept of chronic pathogen colonization. If you've had a cold or the flu or any infection and it resolves so that you're once again clinically normal, if you did not take a biofilm stripping treatment and then a pathogen killing treatment to follow the biofilm stripping, you have this chronic pathogen colonization in your nose and throat for life. You look at all the lotions and potions inside the drugstore for bowel disease, constipation, diarrhea, acid upset, blah, 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 the whole ball of wax. Well, let's just say in many people, I'm not ready to give you a percentage, but I would think greater than 50%. Very many people completely resolve whatever their gut problem is when they start doing a series of these peroxide nebulizations. Because what happens when you swallow the pathogen, that colonizes the gut. The pathogens produce endotoxins, exotoxins, and pro-oxidant metabolites. That causes oxidative stress. And then when the pathogens die, guess what? They release an enormous amount of free iron, which is also highly pro-oxidant. And once again, let me repeat, all disease is excess oxidation in the gut or anywhere else. And in the proximal gut, where you do much of your absorption in the ileum, the junctions in the intestinal cells are tight. They don't normally let stuff in, or abnormally large stuff into the blood and the lymph. When you have a lot of oxidative stress, that becomes weak and you start to allow the influx. This is what causes ultimately peanut allergies, gluten allergies, and just about any other abnormal circumstance that you can. Now, you have intestinal stem cells that turn over every 3 to 5 days, which means these are not chronic diseases. These are chronic diseases that are acutely stimulated every day, 24/7. And when you stop the acute insults, the gut heals so quickly and so rapidly. Let me give you a couple examples. In my presentations, I show the actual email so people know I'm not exaggerating, but I don't have the email to show you. But many cases of irritable bowel syndrome, gone in a couple weeks, people that have had problem with their bowels for years. Number two, one 16-year-old kid with Crohn's disease, very advanced Crohn's disease, bedridden, weak, sick that way for years, multiple drugs, and that took longer. That took a couple months of nebulization, 100% resolution, got out of bed, went back to school, gained weight, never had an abnormal bowel movement again, and became an athlete and a scholar, okay? Just with hydrogen peroxide nebulization. He took a few other supplements, but he had been taking those already. Then another lady, her entire family had black mold disease, black mold illness, and they had multiple hospitalizations. They had to move out of their house. All of them very quickly, completely resolved. Okay, you don't get black mold disease unless it's growing in your gut. Okay, that's where it's thriving. You may eventually have a large enough amount of black mold that you start getting focuses elsewhere in the body, but that's the mother load. When you can allow, and the other good thing about the abnormal microbiome is it would appear that when you stop giving the gut new pathogens, the normal flora can rapidly repopulate and knock down the pathogen population to its quote unquote normal minimal levels. So and of course, as we just said before, all of this is interrelated because of the impact that peroxide nebulization has on the gut. I recommend it for any medical condition you have, because any medical condition you have is going to be either caused by or more often worsened by an abnormal microbiome and a leaky gut disseminating everything throughout your body. Because we have found in the literature, all the chronic diseases that have been examined, they haven't examined them all, but all the chronic diseases they examined, Alzheimer's, other conditions, they actually have the pathogen colonization in the tissues. This is why chronic diseases never get better. Because if you had a one-time oxidative damage, toxic insult, and then no more, a lot of vitamin C would repair that and you'd be perfect. But that doesn't happen. Take a lot of vitamin C, well, you're a little bit better, and then a little worse. That's because you have on-site toxin and pro-oxidant generation in the tissue. So you're always on a daily basis trying to match the daily new toxin production.
I think you've perfectly described my own personal journey. So, a diagnosis with Lyme disease, and I had completely healed myself after a number of years. And then I got COVID. And when I got COVID, it was as though it set me back immediately into that chronic Lyme state.
Relit the flame.
Absolutely. And I've since had COVID now 4 times. And, active infection, very, relatively moderate symptoms. But, it's so interesting that you say that, because I have not jumped down the nebulization path, the rabbit hole, if you will. So that's going to be next on my list. But, I'm kind of taking it full circle too. Interesting that you talk about the colonization, particularly in.
Incidentally, that's also covered in the book, the whole topic of pathogen colonization. I only mention that because I give away the ebook for free, so people can send me an email. They can get the ebook. If they want a physical book, they got to buy it.
I love that so much. I really appreciate your passion for educating people. I think it's absolutely so needed in this world. The one thing I was going to say too is that, I've had chronic sinus issues where I just feel I don't have a runny nose or anything, but just chronically stuffed up all the time. And the one thing that makes it go away, well, I can tell when any treatment is working. But the two things have made that go away almost immediately. One was methylene blue, and the other is IV vitamin C. I get a Myers cocktail, immediately my sinus is clear. So I can tell that these things work just anecdotally, because as soon as I get them, my sinus is clear and I feel much more clear-headed in all of those things. So just for those of you listening who are struggling with some of these issues, I think Dr. Levy's really hitting the nail on the head here, and I'm excited to try some hydrogen peroxide. So
let me add one more comment here. It's a big subject, but I need to mention it in the context of everything else we're talking about here. Is all of these problems are also fueled by dental infections, root canals and abscessed teeth, gum disease, tonsils, and roughly, get this, 70% of chronic sinus problems are due to an infected tooth that's abutting the sinus wall. But I don't think the ENT doctors either know that, appreciate it, or care about it, because how many times does somebody with chronic sinusitis get referred by the ENT to the dentist? Actually, to the biological dentist, I should say. So everybody needs a 3D cone beam examination of their mouth. All the other tests are very inadequate, and this is a problem because it sounds counterintuitive, but these teeth can be chronically infected and they feel fine, and you have no idea at all that you're maintaining abscess pockets in your body. There's nowhere else in medicine, okay, where you have an identifiable infection, focal, where you don't resolve it, cut it out, or get rid of it, okay? In the case of dentistry, we keep it in there. So that's very important too. And that also helps seed and keep reseeding the chronic pathogen colonization as you periodically wipe it out. Gum infections and colonized tongue reseeds it. So to really get resolution to these problems, you really need a global way to do all of this, okay? Simplistically speaking, all perfect therapy has two things. One is to repair, that's a good antibiotic, and the other is to prevent. As Dr. Huggins told me many years ago, one of his most profound statements to me, said to me quite sarcastically, is when I was talking about something, he looked at me and said, "Tom," I said, "Yes, sir." He said, "You can't dry off while you're still in the shower." Okay. And that's what chronic disease is. You're sitting there trying to dry it up, but you're not doing anything about the new toxins coming in or the toxins being generated on site by the chronic pathogen colonizations.
Yeah, absolutely. I think I was speaking to Dr. Debbie Osmond on a previous episode about that. And, I had never had a cavity prior to having what was diagnosed as chronic Lyme disease. And then all of a sudden, I wound up with decay all along the gum line, on both sides of my mouth, severe decay to the point that, I ended up having to have teeth extracted and thankfully never got a root canal. But
Thankfully.
yeah, but a number of issues and also cavitations at the site of where my wisdom teeth were pulled many years earlier. So I do kind of want to get into some of that because I feel like you've made this connection that I don't feel like a lot in the medical community are making. So when we're talking about the general health of the oral microbiome, of the tonsils, and all of these things, how do we maintain and prevent to start with? And if we do notice that there's chronic infection, let's say in the tonsils, what are some of the things we can do to eliminate those kinds of pathogens?
It's interesting too. You just made this point about how there's a lot of denial or not willing to acknowledge. I recently wrote a paper called "Root Canals Cause Breast Cancer Frequently." Clear cut. I have 262 current references, all in the last 4 years. It's all there. It's all in the literature. And you actually grow inside the cancer cell and surrounding the cancer cell the pathogens from the mouth that are supplied to by the lymphatic circulation. And I get more emails, it seems, from breast cancer patients around the world than anything else. And usually they email me because they know I've worked a lot with vitamin C. So that, Dr. Levy, I've got breast cancer. I'm not taking this chemo and I've got this and I've got this. How much vitamin C should I take? As if that's the only thing that can be done. And I write them back. I showed them the article. I said, you're ignoring the elephant in the room. The elephant in the room is the infection that's continuing to feed this. It's a direct pathway, absolutely direct pathway for the lymphatic circulation, gravity dependent, puddles in the breast. It's inevitable. And I write that back. And they say, okay, fine, Dr. Levy, but how much vitamin C do I take? I mean, so you're really working against a lot of entrenched concepts. And even now I see all these breast cancer organizations in medicine, in alternative medicine and integrative medicine. And the most important factor still doesn't get addressed. So what do you do about all this as a part of it? Well, first thing is you do need the 3D cone beam examination. Okay. Root canals, and you get also teeth that due to age, they split, whatever, or you have gum disease that gets to the tip. Either way, from above or below, they infect the pulp and you form an abscess at the tip. That's a dead tooth. Even though there might have pain in the jawbone, that is now a dead tooth, and you're doing yourself no favors by keeping it in there or by doing a taxidermy with it, with a root canal process, by filling it up with oral substance. It stays infected, and it will always stay infected. So those need to come out, and they need to come out correctly with a biological dentist, someone preferably who uses ozone and other platelet factors that help coagulation and help healing. Also, you need to address the gums. It's amazing how simple that can be for even the most advanced gum disease, which ultimately is the reason why these teeth get infected most of the time. It just tunnels on down. Something as simple as regular water pick irrigation with a couple hundred cc's of hot water and about 30 or 40 cc's of 3% hydrogen peroxide. Those pathogens get killed and the tissue starts flourishing again. I've seen beautiful gums result where beautiful gums did not exist after 2 to 3 weeks of this type of treatment. They'll grow back quickly. Now, another thing you mentioned, and is very ignored, but very, very important, is when you have the gum infection or the tooth infection, either one, okay, for any period of time, probably just a few months, but most of these things people are there for years, they're right in line with the tonsils. And in fact, for example, when you put special dye ink in the gum or near the pulp of a tooth, within 20 to 30 minutes, you see the dye spots on the tonsils. So they're continually to drain everything that's in your mouth. Because of this, 100% of tonsils, even though they look normal, even though they don't look inflamed, are chronically infected when you have had these infections in the mouth. And that's why part of a good protocol to minimize toxicity, keep the C-reactive protein down in your blood, that's an index of inflammation, is to treat the tonsils. Treating the tonsils involves one or both of direct ozone gas injections in the tonsils and direct putting drops of methylene blue on the tonsil itself. Methylene blue is extremely well absorbed, and as is ozone. Either way, they both get to all the tonsillar tissue really quick. An additional thing, if you have access to it, people need their own ozone machine to do this, is when you do ozone ear insufflation, okay? Ozone gas going into the ears, 5, 10, 15 minutes of the right concentration. It gets extremely well absorbed in the distal part of the ear canal, not the bony part, but the distal part, very rich with blood vessels. And it actually is a systemic ozone treatment as well, just like rectal insufflation. But the middle ear, connected by the eustachian tube to the nasopharynx and oropharynx, nasopharynx, it's all part of this system where we're trying to get rid of the chronic pathogens. So many people will have a chronic pathogen colonization in their middle ear that continues to feed everything else after you've knocked everything else. So a really complete treatment would involve this as well. A practical point, and this only applies to me, and I have had feedback from other people that said it works for them too, but I'm not ready to tell you this is going to happen with you. But after my experience with the peroxide nebulization some 6 or 7 years ago, I've since found that even if I'm feeling well or a little bit off, if all of a sudden the nature of the bowel movement is no longer perfectly solid, it's time to nebulize again, and the next day it's perfect. So the quality of the bowels, at least for me and a few other people that I know of, is one of your direct monitors as to whether or not you've had a resurgence of chronic pathogen colonization from whatever source. Like I said, you could knock it out, and there's a whole lot of these other areas that could reseed it. So you mentioned COVID too. COVID is especially bad at making it very difficult to resolve this chronic pathogen colonization. They've identified the pathogen in the gut, in the intestines, in the area that we're talking about. But I will tell you this interesting little story. I won't go into all the details. I'll just say I have a friend in Cali, Colombia, a friend of my wife. She had a cold when I was there. I had my nebulizer. This was before the pandemic. So I said, here, try this. And within a few minutes, she stopped coughing every 15 seconds, did a little bit more when she went home, felt great the next day. I mean, it was a pretty significant cold. And when I was getting ready to leave to come back to the United States, she said, oh, can't you leave the nebulizer with me? It was a $30 nebulizer and a $1 bottle of hydrogen peroxide. So I said, sure. Fast forward a year. She became the doctor of her barrio. And she had barrio as like your little divisions of the city. Some were great, some were not so great. Hers was pretty poor. She had 20 different patients, 20 different people who had not only COVID, but advanced COVID, because they were already severely short of breath. If you have COVID and you're severely short of breath, you're close to clocking it. You're close to punching your time card. Well, and of course, these are poor people. So there's no vitamin C, no vitamin D, no vitamin nothing, no ivermectin, no nothing. So all they had was hydrogen peroxide nebulization. And she took it to a great extent, to extreme. She did 30 minutes, 3 times a day, 90 minutes of nebulization a day. All 20 completely cured in 5 days.
Okay? Yeah, that's amazing.
That shows you the power of this, because this is where the viruses have a heyday. Yeah, they get into the rest of your body, but here's where they replicate. When you knock this out, it's like what I call cutting off the head of the viral snake. You cut off the head, and the rest of the snake throughout your body dies.
Yeah, absolutely. I think it's so greatly overlooked. You know, I think about, I used to go into the dentist, a traditional dentist at the time, who would tell me, oh, well, you know, it must be your oral hygiene is terrible and this and that. And I'm thinking, I've never had a cavity. I'm over 30 years old. Like, I don't think it's my oral hygiene. I really think there's something else going on. But when I told them, I think, it's an inflammatory response. I think it's infection colonized within the oral microbiome. They would all look at me sideways. So,
Let me make this comment. And I say it to be dramatic, but I also want to say I don't feel I'm exaggerating. And the statement I make is the worst thing anybody can do for their health is to have a traditional mainstream dentist. But the best thing they can do for their health is to have a good, qualified biological dentist. Just apples and oranges, black and white.
Absolutely. Well, thankfully, I've got a good one now. So I'm on the right path. Well, Dr. Levy, it is now time to ask our 8 rapid fire questions. These questions are designed to just kind of get you out of that, hyperlogical medical speak and into the heart and the soul of who you are.
Well, I hope you don't say anything inappropriate. Okay.
Oh, it's all right. You wouldn't be the first, trust me. All right. If you could choose only one natural remedy for the rest of your life, what would it be?
Hydrogen peroxide nebulization.
Awesome. All right. Tell us something most people don't know about you.
I suppose that I was pretty athletic as a younger person. I won the tennis championship at my high school, something like that.
Very cool. If I were to compile a playlist of happy music, what song would you suggest be added?
Oh, just about all the songs of Fannie Lou, the Colombian singer. She's just got, I forgot the name of the different songs, but she always is very upbeat. And whenever that music comes on, my spirit lifts.
Awesome. I love it. I've never heard of her, but I will have to check it out. What is your favorite guilty pleasure?
There's so many. I suppose an extraordinarily good dessert, usually something with ice cream and a perfect cake.
Awesome. What is the most influential book you've ever read?
Maybe How to Win Friends and Influence People.
That's a great one. I read that one. I was
a long
probably
time
in
ago.
my late teens. Yeah. Yeah.
Oh, and actually, let me qualify that a little bit too. Many Lives, Many Masters by Brian Weiss. Okay. When we all realize that reincarnation is not a fantasy, but a fact, and we're going to live a lot more scenarios in the future. Let's try to make them good ones.
I've read that one as well. Very good. All right. What does the word revolution mean to you?
Revolution, more than anything else, means to me that you have individuals who have a clear-cut idea of who they are, what they want, what they require, and most importantly, what they're willing to stand up for and, unfortunately, as the case may be, often die for. So revolution, more to me, it means more to me than the revolution. It means to me the conviction and nature of the people that are involved in the revolution.
I love that. Very profound and very true. What does the word remedy mean to you?
Something that results in an effective resolution of a set of symptoms or a problem, but something that's effective.
Absolutely. And lastly, if you could impart one piece of wisdom onto our listeners, what would that be?
Do your due diligence and, to as great a degree as possible, be your own doctor, but also find yourself a good integrative doctor to work with, because if you just submit yourself to mainstream medicine, I'm not optimistic for your future. Okay. And anybody who's been through the pandemic and has had their eyes shut rather than wide open, the problem is when you're sick, you're scared, and you're passive, and you don't want to think, and you don't want to be proactive. You just want to turn your warm body or not so warm body over to somebody in the hopes that they're going to do the right thing. And right now, that happens so rarely in modern medicine, I can't tell you. All modern medicine does is diagnose, and they do that well. And they cover up symptoms, and they do that pretty well. And they either are not aware of the underlying disease process, or they don't care that there are ways to reverse that disease process. So it starts with having a doctor you can communicate with. If you have questions for your doctor and they won't answer them, don't walk out of the office, run out of it. So ultimately, we have the internet now. So these are things we didn't have 20, 30 years ago. The information wasn't there. And I'm not saying everything on the internet is correct, but when you see enough different sources with enough different people that you have respect for, promoting a certain point of view or way to approach something, you're on a lot better footing than if you just go through the phone book and pick out your first mainstream traditional medicine doc that you could find. So you need to take care of yourself.
Absolutely. I couldn't agree more. So for those of you listening today who would like to find out more information about Dr. Levy, his books, you can visit tomlevymd.com. There are some of the books available, I've noticed, on Amazon as well. Is there another spot that you would prefer they contact you, Dr. Levy?
No, that's the best, the website. And I don't hide from anybody email-wise. I don't do consults, but I can help give people information, and that's televymd@yahoo.com.
Thank you so much, Dr. Levy. It has been such a pleasure. Thanks for being part of the revolution. We'll see y'all next time. Take care.
Okay.
With hope as a guiding light, through darkest days we'll fight the night. With a whole lot of passion, with a whole lot of truth, Remedy Revolution is here for you.